How are you?
It's so good to see you.
It's so good to see you too.
The Parade Company.
How cool is this?
I've never been here before.
I feel like a little kid.
I do too. Let's go
know.
check some of it out.
Look at Big Bird.
I know.
Cookie Monster.
So I'm curious, why are we here? What is your connection to the Parade Company?
Well, the Parade Company, Henry Ford Health is a big sponsor for the parade every year. And it was a great opportunity for us to use that as a platform to talk about Henry Ford Health. And Bob Riney is on every year with Devin Scillian.
Bright and early.
Bright and early every Thanksgiving. And it's just wonderful. And really what's so important in the way to achieve greatness, partnerships.
Yes.
Partnerships are so important in every aspect, and especially as a fundraiser, we can't accomplish something alone. We need to have partners. That's why our Michigan State partnership is so important. The Parade Company, the Detroit Lions, the Detroit Pistons. We can't achieve greatness without key partnerships.
Well, MJ Vogt, you're our Executive Vice President and our Chief Development Officer. For people who might not know, what does that mean? What does your day-to-day look like?
Well, essentially what that means is we raise dollars to support the strategic initiatives for Henry Ford Health. And really at the end of the day, people want to know that their money made a difference. They want to hear impact. They want to know that they're advancing healthcare, helping discover, innovate, cure diseases. And it's an extremely rewarding career.
How did you even get started in something like that?
So, and I'm going to date myself right now. In 1997, I was looking through the Detroit Free Press classified ads. So I saw an advertisement for a job at Henry Ford running a golf outing. And I thought, how cool is that? Someone's going to pay me to run a golf outing. Well, fast forward 6 months later, I knew I was hooked. I saw the impact that the dollars that we raised, that tournament raised money for cancer research, and I was blown away. Meeting the physicians, meeting patients that benefited, I knew I found my home.
Wow. Talk to me about your trajectory. How did you get to this position?
So I always believe that you have people that help you along the way. So I had an early mentor who saw that I had the ability to do more. So I weaved my way through the Department of Philanthropy, and I started out in annual giving, to do corporate giving, to do major giving. I actually even ran our database at one time, which is a little scary because that's not my gig. But I loved the fact that I had the opportunity to touch every area of development and fundraising, so that I really had a broad breadth and understanding of the importance of it and the importance of how they all come together and work really, really well.
This is one of the Henry Ford Health floats that we're looking at, right?
It is, it is.
Yeah, and how important is it for us to be involved in just institutions and traditions in the city of Detroit? Because we are an institution.
We are.
And almost a tradition, in the city of Detroit.
We are, and it's so important. And it's so amazing to see Detroit and the comeback story that we've had. But there were a lot of years where people weren't paying any attention and they weren't investing. But Henry Ford stood here the entire time, and we never wavered in that. And it's really cool to see so many people who finally are doing what we've been doing for a number of years.
Yeah. You must have learned some incredible lessons along the way and had some awesome mentors. Can you tell us, one or two of the lessons that have really stuck with you during this time?
Yeah, there was a lesson that I learned pretty early on. It was maybe 2 years into working at Henry Ford. And I was overseeing a program called Annual Giving, and we do mass mailings to 30,000, 40,000 people at a time. Someone on my team made a mistake. I was sure I was going to get fired for it. My boss was really upset. I went into his office and I said, I'm sorry. I should have been the one to catch it. And immediately, everything de-escalated. And he was understanding. He looked at me and he said, okay, thank you. Let's fix this together. So it was a really profound moment that we all make mistakes in life, and you have to own it. And you have to learn from it.
You come from, development, where you're really at the at the heart of what you do, right, is our best interest and our patients' best interest and our team members' best interest, that we have the money that we need in order to be successful today, tomorrow, you know, 100 years from now, right?
Absolutely, absolutely.
Where do you see the future of healthcare going from your individual perspective?
So it's a really exciting time for how we treat our patients, where we treat them, when we treat them. And at the end of the day, I'm so excited to be able to raise money for the future of healthcare. We're going to be building a brand new campus, and that excites me because the technology that will be there, the way that we'll be able to serve our patients in a better manner is really exciting. And at the end of the day, we want to see a more healthy community.
Are you proud when you look at the different floats that we have here?
Oh, I'm so proud.
Yeah.
I mean, I've talked a lot about the many reasons I'm proud of Henry Ford Health, and this is one of them. Celebrating Detroit in the Thanksgiving Day Parade and the tradition that it's become, and it's just incredible.
Yeah.
So proud when I see it.
Me too, me too. Well, I was gonna say, what are you proudest of at Henry Ford Health?
Oftentimes philanthropy comes when there's not a good outcome in healthcare. And actually Dr. Munkara was the physician of a young woman who had cancer. And I don't want to get emotional, but the family set up a really significant philanthropic fund in her honor. And while she was still alive, I helped them figure out what that gift was going to benefit. And what she wanted it to benefit was, it's called a Superwoman Fund. And she realized in her cancer journey, she had the means. She had family support, she had it all. But she would sit in the waiting room and see women who were on their own, clearly didn't have the financial means. So she said, I want to have the ability to almost like adopt a patient and be with them throughout their cancer journey. But when you look at someone who has to make a choice to decide to put food in their cupboards or get a prescription, they don't have the ability to get to their treatment, they're behind on a mortgage payment, we don't want patients to have to make those decisions. And so that's where they dedicated the dollars. So, sorry.
No, but truly your emotions just show me how much you care and how proud you are to be able to bring programs like that to our patients.
Yeah. Well, and I'm proud that Henry Ford is set up to be able to do that and want to do that, understanding that if our patient, you know, lives on Lakeshore Drive in Grosse Pointe, or they live in their car sometimes, they're going to take care of them the same.
MJ, your trajectory to where you are today, when you look back at that young girl in Birmingham who might, be watching you today, what would you say to her? What would be your advice? Would she be proud of
Oh, she'd be totally proud. Yeah. I would say take advantage of every opportunity that's out there. Never say no. Pursue your dreams, and be a good person.
And that's advice you'd give to any woman or any person really working in our organization.
Absolutely. Don't settle. Do something that's going to make you happy. When I wake up on Monday, I don't have a pit in my stomach when I come to work. I'm fired up. I'm really excited to come to work.
MJ Vogt, our Executive Vice President and Chief Development Officer, thank you. This was a pleasure and very fun.
Thank you so much.